All right, you guys, welcome back. My name is Eric Christensen. I'm the owner of Chandler Physical Therapy along with my wife, Ashley. And today we're talking all about that kind of tweaky shoulder that you feel, especially when you're like reaching overhead. A lot of times you might feel it kind of at the top, and it's a pretty easy fix. A lot of times when folks come in, they'll say, hey, I've got the shoulder pain. It's not all the time, and it's usually what we call positional. It's like if I do this, it hurts, but if I'm not doing anything, it doesn't hurt at all. We call this kind of classic shoulder impingement. And there's usually one kind of main culprit that I see in combination with a few others that you can easily target to try and tackle this problem. And so it's what we call your shoulder capsule. And the shoulder capsule kind of goes all the way around the shoulder. If we can kind of see here, this would be your shoulder. Here is your shoulder blade. This is the top of your arm, and this is your collarbone. So this would be my right shoulder in this capacity. If it's reversed on you, I'm sorry. This kind of off pink colored thing would be your shoulder capsule. And so it wraps all the way around and it keeps fluid around the joint and it keeps the joint in place, and it helps with the rotator cuff to kind of keep everything stable and moving well within the shoulder joint. Very commonly, because a lot of our world is with our arms more down by our sides than overhead, that bottom part of the capsule gets stiff because it's not explored regularly. And so when we look at the shoulder from the side, when we go to reach overhead, this shoulder has to rotate, okay, but it also has to kind of glide backwards and also has to glide downwards. And what happens when this gets stiff, this kind of bottom part of the capsule there gets stiff, is that instead of rotating and gliding, it just rotates, and we end up getting this pinch up underneath here, kind of the top of the shoulder. And that's kind of what we call shoulder impingement. And that pinch initially can just be painful. If it persists over time, it can turn into a bursitis. And if it persists longer than that, we can actually see some tearing of the tissue. Sometimes you'll see a rotator cuff tear or a bicep or labral tear, you might hear. And so we want to address that right out of the gate. It's an easy fix. And one of the things we do here at Chandler Physical Therapy is what we call an inferior glide. And to try and demonstrate that, let's see if I can get this camera going. I want you to imagine you'd be up against the wall with your elbow at about your shoulder height, but for visual purposes, I'm going to kind of rotate here. You want to think that your elbow and your shoulder are roughly about the same height. Take your opposite hand kind of on top of your arm, not necessarily the shoulder, but more the arm. And what you're going to do is just with your arm planted against that wall, you're just going to kind of lean your weight into it, push a little bit of pressure down with that hand to kind of stretch that bottom side. Now, this is not a more pain, more gain situation. It's an on and off type situation. And you want to politely knock on the door of discomfort, not knock that door down. Okay. This is something that you will see gains of if you do 1 or 2 weeks of it, not necessarily an overnight success story. And too many times I see people just crank it through pain. And if we think about the mechanics of that shoulder, that pain is when that tissue is starting to get pinched. So we want to flirt with that. We don't want to overwhelm it, because if you're just cranking into that pinch, that's where we see the tissue get irritated, and sometimes you can create a flare-up. So if this sounds like you, and if you have questions, let us know. Comment or message us on whatever platform you're kind of watching this on. We do have a free discovery visit, so if you want to check that out, it's at chandlerpt.net/discover. That will let us know that you're interested in kind of just sitting down, meeting. It's a one-on-one chat with us, with the physical therapist, to just kind of assess your body movement, see what's moving, see what's not moving, and then kind of give you a rundown of what PT can do to help or not help, or if there's a different avenue that we might recommend entirely. So I hope you guys have a great day. If you do have questions, let us know, and we'll catch you on the next one.